10 years ago, I stood on the global stage at the 2016 UNGASS on drugs to speak not just for myself, but for millions of people who use drugs, particularly in Ukraine, where stigma, criminalization, and barriers to health and human rights were daily realities. Since then, change has been hard-won, but it has come. For me personally, UNGASS marked a turning point. It legitimized our voices as peers, not just as beneficiaries, but as experts with lived experience. In 2017, we established the first ever Ukrainian network of people who use drugs, Volna, helping me become more deeply involved in shaping policies, leading community responses, and working alongside others to push back against the outdated and punitive drug control systems that harmed us. Since then, opioid agonist therapy take-home dosing reached 85% patient coverage. Today, we have the largest OET program in the region, covering more than 25,000 clients. People who use drugs began to be seen as partners in HIV and public health responses, not as the problem. Volna became members of the National HIV Tuberculosis Council in Ukraine under the Cabinet of Ministers, giving people who use drugs for the first time ever a vote equal to that of the health minister on decisions that directly impacts our lives. The war has pushed many of these fragile winds over the edge. Displacement, trauma, service disruption, and increasing stigma have hit our community hard. Yet, the foundation we had built, rooted in human rights, solidarity, and peer leadership, has helped us to survive and respond with resilience. The 2016 UNGASS gave us a global platform, but the real work was and still is at the grassroots level. We need global commitments to be matched with resources, political will, and protection for our communities, especially in times of crisis. The UN drug control system must shift from punitive policies to ones focused on health, harm reduction, and decriminalization. We must fully respect the decisions reached by member states on the last Commission on Narcotic Drugs and finally reconsider the global drug policy framework and stop the war on drugs. The international system must support and empower local, peer-led organizations that are on the front lines of this fight, because they are the true experts. 10 years on, we are still here, still fighting, and still will not be silenced.